Calling to order the Winnebago County Community Mental Health Center. Mental Health Board. Today is August 6th and it's 10 a.m. Roll call. Mary Ann Abadi here. Andrew Bradshaw here. Dr. Copeland. Dr. Giardini here. Dr. Gorski
Here.
Dick Cooner
Here.
Tim Neighbors. Jeff Nielsen.
Here.
Dr. Penny. Mohammed Yunus.
Yeah.
Jason Holcomb.
Yes.
Okay. And welcome guests. We did have someone sign up for public comment, but
Is Laura Fry here?
not present. So we'll move on now to the presentation, which is going to be the guidehouse presentation, the consultants.
Sure. I'll just briefly, for everyone's memory and also for anyone watching on public that maybe is not familiar with this project, the mayor of the city of Rockford, Mayor McNamara and Chairman Shirelli, had convened some of the operational leaders for health systems in Winnebago County probably 2 years ago to take a look at the coordination of care and access to care. That resulted in an accelerator award application to the Mental Health Board that was approved, and that was it is being administered by the Community Foundation of Northern Illinois on behalf of the advisory committee. And the project was to hire a national consultant to take a look at the system of care for Winnebago County and provide some recommendations for coordination and access. And Dan Ross, who was the executive director of the Community Foundation at the time of the application, has stayed on as the co-chair for that committee and will introduce our consultants today.
Thank you, Jason. Good morning, everyone. Yeah, as Jason said last time I was here, I was in an entirely different role. So I'm there as just a community member who stayed involved with the project, but very, very thrilled to be here this morning to have our consultants make a presentation to this organization, this group, about the work that's been done in the past 7 months. I know nobody's here to hear me speak, so I'm going to keep it very brief, but first and foremost, I just want to say thank you to the spot. But for the accelerator grant, we've not been able to do the work that you're going to hear about today, and I'm deeply excited about what Guidehouse has brought to the table for consideration. And so, without further ado, I want to get looking to see who is actually on. There's what I'll do is I'll let the team from Guidehouse introduce themselves. So I don't know who's starting out, but we've got them all here on Zoom, and so I will take it over to them. But thank you again for the opportunity.
Thanks, Dan. And Jason, just a quick audio check. Can you all hear me?
Yes.
Okay, fantastic. Well, good morning, and thank you for having us join you this morning. We're excited to spend a few minutes with you reviewing the behavioral health system in Winnebago County and the associated project. My name is Jamin Barber. I am also joined with Dr. Charlie Smith, Sydney Pedraza, and Chiara Alvisi, who form the entire team of consultants and subject matter experts in regards to this project. And we're very excited about presenting to you this morning. We're gonna, if you go to the next slide, Sydney. We're gonna do a quick overview of the project itself. I'll lead that discussion, and then I'll pass it over to Charlie to talk about what we learned in the process and our recommendations. And then I'll wrap up with what's next. Jason did, next slide. Jason did a wonderful job overviewing this first slide that we have. Winnebago County Community Mental Health Board recognized the challenges in the county's mental and behavioral health care system. To address this, Guidehouse was asked to assess the county system with a focus on assessing current services, identifying gaps, and developing a more accessible, coordinated, and responsive behavioral health system for the residents of Winnebago County. Guidehouse has completed a report with recommendations for consideration, and ultimately the collaboration aimed at making care easier to access and more responsive to the needs of residents in Winnebago County. We feel confident the initiative is crucial for improving mental health outcomes in the county, and we're excited to briefly share our report findings and recommendations. The next slide, please. Before I pass the mic over to Charlie to review findings and recommendations, I wanted to review our approach to the project at a very high level. We broke the process down into 4 phases, and in the first, the project initiation phase, we collaborated with key stakeholders to set goals, timelines, and roles within the project. We developed a plan for collecting and reviewing data on mental health needs, the services that are provided, and the resources that are offered across the county. In the second phase, or the research phase, we reviewed local reports, strategic plans, and service data. Focus groups were conducted with providers, community leaders, and individuals with lived experience, which we very much appreciate everyone's time and that process. And we also studied what we consider to be best practices from across the country to identify applicable and innovative solutions. The design and prioritization solutions phase had a focus on engaging with those stakeholders identified in the second phase to develop and refine recommendations. So we really tried to create a journey for everyone through this process. We also considered costs and existing policies and used a scoring system to prioritize recommendations based on their impact and their feasibility for Winnebago County. And in the final phase, referred to as finalization and prepare for action, we identified outcome measures to track progress and success. We shared our findings and recommendations with stakeholders for initial feedback and developed a final report and roadmap to guide the next steps for Winnebago County. This structure, this four-phased approach ensured that we address the challenges in our mental health and behavioral health system methodically and collaboratively, leading to a more accessible, coordinated, and hopefully a responsive system for county residents. I'll pass the mic over to Charlie to review what we learned and highlight recommendations. Charlie, please.
Thank you, Jamin. I do want to just double check, since Jamin and I are 2 different locations. Hopefully I am coming through. If people can give me a thumbs up, that would be great. So good morning. As Jamin introduced, my name is Dr. Charlie Smith. I'm the behavioral health lead for our Guidehouse team, and really have had a distinct pleasure with working with the entire committee, as well as on this project for Winnebago County. As Jamin had set up quite nicely, I really just wanted to highlight some of the things that we have learned, and much of this is probably going to be very apparent to you, but I think it really confirms the opportunities as well as some of the challenges that are going forward. I mean, overall, Winnebago County and the mental health and behavioral health provider network is very strong. It's committed to providing high quality of care. However, agencies tend to work in silos. They kind of stay in their lanes, which can result in gaps in access as well as care coordination, particularly when individuals are referred to different parts of the system. So at a high level, we really saw things that jumped out at us, and one of which is that many people simply don't know what mental and behavioral health services exist and how to access them, especially among individuals with limited English proficiency. And this highlights the ongoing need to target outreach and education, as well as efforts to reduce stigma. We also saw that individuals that even recognize that they need assistance or help, there are gaps in accessing care. And mental health and behavioral health care is not always easily available. And we saw that geographical disparities, where some neighborhoods as well as communities have fewer options, pointing to the need to expand as well as make sure that services are equitably distributed. There are barriers such as transportation, workforce, as well as rural distances between the individual and access points for care that make access difficult. This is an opportunity to kind of look at solutions that focus on mobile outreach services, coordinating behavioral health services within jails as well as schools, and making sure that services are located near where people live. We also recognized and saw that long wait lists and provider shortages, as well as inconsistent insurance coverage, especially Medicaid and Medicare, can create obstacles, even for someone who is seeking care. Strengthening the workforce, extending service hours, as well as ensuring that there's an equitable insurance coverage are always critical. And then finally, for many people who initially access mental and behavioral health services, they can fall through the cracks, particularly when they're referred to other agencies. And this is oftentimes due to inconsistent referral protocols, follow-up or disconnected systems. And it's an opportunity to really help strengthen care coordination, care navigation, shared consent processes, and even using technology where applicable to really ensure that care is not interrupted. When together in all these insights really kind of underscore the opportunity to really elevate an accessible, coordinated, as well as accessible mental and behavioral health care system. Next slide. So factoring all this information in and considering what we learned, the data that we received, the stakeholder conversations, our report outlines really a bold new vision for mental and behavioral health care in Winnebago County. It's rooted in the community, and it's centered around a hub and spoke model, which is designed to create a stronger and more interconnected network of critical public health, behavioral health, as well as social service providers, as well as agencies. As I frequently talk about, and I'm sure my team is quite used to hearing me say, that mental and behavioral health care is a team sport, and requires a high degree of coordination, collaboration, and communication to support individuals and families where they're at when they're particularly struggling with mental illness and addiction. This new framework, this vision is really kind of focused around a hub and spoke model, with the hub being Rosecrans. Given Rosecrans's role as Winnebago County's comprehensive behavioral health care agency, Rosecrans is well positioned to lead coordination, drive quality improvement, as well as integrate services across the entire county. Surrounding this hub in this visual is an interconnected network of spokes that include primary care, that include hospitals, schools, public health, jails, housing, first responders, and other social service programs and advocacy organizations that are all working together to deliver a coordinated, interconnected service delivery system for individuals and families when they need it. The model on the right-hand side really is anchored by 5 objectives that are focused on promoting emotional health and wellness, reducing stigma, and really encouraging that people know and how to access help early. It focuses on early entry points and navigations to make sure that residents can find and access services through clear, coordinated pathways. They understand that if you are seeking mental health services through a school system, that school system's entry point is connected to this larger network with Rosecrans and the other kind of service providers. It focuses on expanded access and care coordination through a full spectrum of services that are timely, available, and equitable. It fosters and prioritizes a welcoming, accepting, and inclusive system where everyone, regardless of their ability to pay, as well as geographic location, has access. And finally, it strengthens mental and behavioral health care through care coordination, through agency partnerships, care coordination, referral systems, data sharing, so that no one falls through the cracks. Ultimately, we really want this recommended roadmap to serve as a model by which Winnebago County can really create a network of coordinated care. It's grounded in industry-leading examples. It's tailored to Winnebago County's network of providers as well as programs. Ultimately, we want this blueprint, this actionable approach to integrated behavioral care that's rooted in the community and is designed to meet everyone's needs, no matter where they are. Next slide. And then finally, as community leaders, you know well how critical it is for residents to have access to timely, effective behavioral health care. We wanted to kind of demonstrate how an integrated behavioral health care system can transform the experience for people in Winnebago County. Right now, the system, like most systems across the country, is fragmented. People oftentimes don't get the care that they need. Services can be scattered, and access depends too much on where someone lives or the type of insurance that they have rather than what they actually need. The new model, this new vision that we're recommending, is community-based. It's rooted in the Winnebago community. It's integrated to address the needs head-on, with Rosecrans serving as a coordinating hub. Mental and behavioral health prevention, treatment, crisis services, and recovery support are organized into an interconnected network of spokes, ensuring that no matter where someone enters the system, they're guided to the right care at the right time with the highest quality. We believe, and we've seen, that this means faster access, better follow-up, and inclusive care so that everybody has access no matter their ability to pay, as well as no matter where they are. So for you, we hope that this provides a clear opportunity and an actionable blueprint where Winnebago County's mental and behavioral health care system can grow, it can improve, it can enhance partnerships, and align resources that ultimately improve access and care coordination, and really helps to support Winnebago County's prioritization of emotional health and wellness and prosperity for all citizens. So with that, let me kind of pass this back to you, Jamie.
Charlie. Go to the next slide. The model presented provides a deliberate direction for building a system that, as Charlie mentioned, is connected, inclusive, and easy to navigate. Achieving this vision will require strong collaboration between all stakeholders through the hub and spoke model that Charlie spoke of, and targeted investment in 4 areas. And you can see them in those boxes listed on the slide: workforce development, data interoperability, housing, and lastly, social supports, including peer supports. We tried hard to establish outcome measures to track progress transparently and assist in reducing disparities, building trust within the community, and supporting mental wellness for all. WCCMHB remains central as both champion and leaders of this effort. We believe that with ongoing leadership from all stakeholders and smart investment, Winnebago County can become a statewide model for person-centered behavioral health care that is truly community-based. Hopefully this very quick presentation has been enough of a carrot for you to want to learn more. And if you would like to do so, we certainly, especially around the details of the report or findings and recommendations, we certainly welcome you to read the final report, which will be emailed to you and shared with each of you on the committee. And we certainly welcome any feedback and are happy to take questions with any remaining time we have.
Okay, maybe 2. Mr. Barber, can you hear me?
Yes, good morning.
Good morning. This is very well presented. I'm not gonna make up anything on this. I thought this was really well done. My only question is, everything looks good on paper. How is it going to apply, in application? You had mentioned that you want to get rid of some gaps, but all programs have gaps. Do you anticipate any gaps in what may happen with your presentation here?
Yeah, I mean, Charlie, we can both speak to this. I'm certainly happy to start. I think the secret sauce in this approach is going to be ongoing collaboration between all partners, as mentioned in that hub and spoke model. So if we have failure and an inability to collaborate collectively, I think that's where we're going to see slowdown or obstacles in implementation. It's just absolutely key. And doesn't all fall to Rosecrans, as they are the hub in that model, but it requires the spokes to be strong and deliberate in pushing all of those initiatives forward. So Charlie, I'll allow you to,
Yeah.
any other comments?
Yeah, I appreciate that. I think that your comment and question is spot on. One of the biggest challenges in developing system networks is how to make sure that there's appropriate leadership to really be that champion for collaboration and to bring together from kind of a shared vision of the various partners to support this integrated model. Now, within that shared vision, there's also a need to have some incentives and some value add. And I think this is where Rosecrans is in a very unique position since they were just certified by the state of Illinois as a comprehensive community behavioral health clinic, which opens the door for this infrastructure to naturally fit within Rosecrans, and actually within that structure and that certification at the state level, it actually requires partnership across a multitude of providers to include primary care, hospitals, but also the public health network, as well as the other social service programs that really envelop that coordinated care system. So I think that, as Jamin had indicated, that partnership and bringing together is really strengthened and or dependent by that leadership, as well as making sure that data and resources and programs that are evidence-based all remain aligned. And there's an opportunity for you as a board to be that also consistent champion and contributor to the success of this model. So hopefully, I think though you're asking the right questions, and it's a great opportunity to remain vigilant with regard to the development and the intercoordination of the network.
Well, Charlie, this might be for you, and again, I echo the appreciation of the work that you've done in this matter. It's well put together. I'm thinking, of course, of this board that we're all sitting here on today, and there was one mention of it in your presentation, but in thinking of Rosecrans as the hub, I think we received grant requests from a variety of organizations in our county, some of which have varying levels of connectedness, and some of them don't.
Right.
If that model of granting that we do were to continue, I could foresee a scenario in which we receive grants from an entity that really don't support ongoing growth of the model or even support the continuation of the silo. So as we get into our own grant-making, decision-making, I'm trying to imagine how that works. Is Rosecrans then the clearinghouse of those folks wishing to submit a grant such that it is consistent with the community-wide model? I'm trying to get my head around how our work continues so as not to go off in a rogue direction.
Right. I think so. I did not provide much of my background, but I'm the former commissioner of mental health and substance use in the state of Colorado, and worked for about a decade with the federal lead agency for mental health and substance use that actually developed a program for certified community behavioral health clinics. But I think what you're talking about and the questions that you're raising are still very new. The CCBHC model, as it currently is established around the country, is opening the door for these type of collaborations with not only community mental health centers and hospitals and primary care, but also including the role that counties and public health agencies and housing programs and WIC programs really can kind of come together. You're asking the right questions with regard to how can the county maintain its role while at the same time not move away from the independent, small, critically important providers that are doing street outreach programs, that are working with your rural communities that may not be automatically connected to this larger network, but there are ways in which those providers can even be seen, even though there's not a formal partnership or relationship. And this is not advocating for a business relationship, but being part of that larger network, so that should a smaller provider that you may be funding, working with a unique population in a unique way to make sure that they kind of have clinical programmatic air cover and connection to a larger system, should any one of their clients or individuals they're supporting need that level of care, that interconnectivity, I think, is critical regardless of whether there's a CCBHC or hub and spoke model, and having worked in rural, suburban, and urban areas, you want to make sure that those connections to those important systems are fresh and alive in case I just have one case where I need that connection. I'm also not necessarily in a position to kind of advocate, do you need to communicate that there's a required connection in any of your grantees? But there may be a way to kind of layer your review of applications to see if there's a connection to Rosecrance or to this larger behavioral health network, and to even encourage it in any of your applications that you are reviewing. But I think this is something that you as a board can be working closely with Rosecrance as well as with the Mental Health Advisory Committee to think about those nuances as it moves forward, supporting, at least within the county, that there is a unified system that's all interconnected, and there's a place for everybody to have access. I feel like my answer may have been a little bit long-winded, and that was not my intent.
No, I would just say that you got at my point there with, would we ever, it's a potential require such connectivity to be a prerequisite of funding? Because again, if somebody would need to do that, either us or Rosecrance, or someone would need to determine. So you understand, I just have one other question and I'll stop. But you have on your slide one bullet point about inclusivity relative to ability to pay. And I also wonder how, again, with disparate organizations that have disparate business models, how can we actually make a statement that with whatever the payment mechanism is, including none at all, we can get to the point of ensuring that that person, that individual can receive care?
Yeah, so at least within the CCBHC model, and my apologies for using acronyms, but this Certified Behavioral Health Clinic designation that Rosecrance has, that designation actually opens the door, very similar to your federally qualified health center, to actually work with the state to have a different payment model when it comes to Medicaid, individuals who have Medicaid. There is always a challenge when it comes to individuals who may not have Medicaid or may be underinsured when it comes to Medicaid, Medicare, and or other private insurance. However, just like a federal qualified health center like Crusader, Rosecrance has an obligation to serve anybody who walks in the door. And there is an opportunity for not only Rosecrance, but their partners within this model as potentially alongside the board to make sure that for those individuals who may not have insurance, there's a mechanism by which there could be financial coverage. There's a potential, and we've seen this in some other counties that actually have sales taxes dedicated towards behavioral health services, where they've used that to cover the cost of services for individuals who are uninsured or underinsured. There is a mechanism there for you as a board to consider, making sure that that coverage is there and that then the services within the network remain consistent and equitable. But there are other mechanisms that I think Rosecrance and the other providers can look at, whether it's through insurance, whether it's through Medicaid, as well as any other kind of investments that the state may be making for those individuals, regardless of their ability to pay. But coming back to just the language for a federally qualified health center, as well as now a certified community behavioral health clinic, the federal language, which is carried through the state certification, is that they have to provide services regardless of regardless of the ability to pay for somebody walking.
Thank you, appreciate it.
Yep, you're welcome.
Bill, I think we're really positioned to use this effectively as our next step. Because I think the community support program has served us very well. It's given us 11 evidence-based services. The one thing that we know after 5 years is the very issue that Charles is bringing up. The cooperation and coordination has been a difficult piece because we have no structure that in the community that takes us there. So this would, by assuming this hub and spoke model okay, it would give us as a board a structure that we could continue to build all of our grants around, okay, and keep Region 1 exactly in the role that it's played for us so thus far. But now it would be even stronger because the operational behavioral part would be coming from the providers themselves. And it would demand that they get rid of their silos and that they work together. And that, so I think this comes at a really good time. Yeah. And that, and having Rosecrans be already designated that and give us somebody to work with, we could do this.
I agree.
Yeah, and I concur with that, Dick. I think that the buy-in from the health centers, especially the hospitals, that's been a barrier, significant barrier, because, as we know it in Winnebago County, OSF doesn't really provide mental health care. The bulk of the referrals go to UW now. And I think that, and obviously, Mercy got out of the business. So I think that now that there's representation for buy-in, that's a huge barrier that will be removed. And Rosecrans, however, even being in mental health for 41 years and knowing what it's like to have a psychiatric emergency in the ER, and then people waiting in the waiting room for evaluations, off hours, you have to have such tight coordination with Rosecrans to be able to serve the population, and then consider higher levels of care with hospitalizing people that don't have insurance. That's been a barrier too. So
yeah, I think the model, I understand the model completely. To me, as it gets into the detailed execution, the transparency of the data sharing and the full accountability. So if at the end, the true hub is Rosecrans, then they become a hub for us as well. Right, the coordinating, they become, so my question about how do we ensure that we're doing things that are consistent with community interest and not siloed, that's what I was trying to get at. So to me, that's in the execution.
I believe that too. Any other questions?
I have a concern. I agree, theoretically, it all sounds wonderful. Realistically, I am also concerned about the implementation of this project. The entity that has been mentioned multiple times is Rosecrans, and I'm concerned that this program then becomes an extension of Rosecrans as opposed to a community-based program.
Yeah.
I believe there's going to be concern with other entities and agencies that we provide funding for, and smaller agencies in the community. We do have other large hubs, including UW, including LP Johnson. I'm just concerned that people are going to see this, local people are going to see this as local tax dollars extending Rosecrans.
I would just add to that, because I'm having the same concerns too, as having worked in multiple mental health associated agencies in the community previously. I would have seen Rosecrans more as one of the spokes, and I would have envisioned like a combination of a board from multiple agencies being the hub, that those would be the point people and the city would be involved in helping to form that hub. So that way it's not just associated as a Rosecrans kind of organizing, taking over, having undue influence over multiple other agencies who have different philosophies of service and things like that. I mean, they all have the same goals respectively, to treat and give people what they need to have successful, healthy, balanced lives. But their visions on how to go about those tend to be a bit different philosophy. And Yeah, I don't see those grants as like the hubs per se, more as a spoke or even a couple of spokes in that wheel, but not, I wouldn't thought of it that way.
But they really have been designated the hub by the state of Illinois with the certified behavioral health center. They're the only ones that, you know, we have in Winnebago County that have this certification. So I thought that was pretty natural that would happen. But
And my thing with, with both parts, I would see us as a board, we would really have to negotiate those issues with Rosecrans, because there isn't any question that Rosecrans' image within the community is, you know, there's pros and cons. And, but they do have the designation. And so the issue would be for us to help keep them boundaries to do what the certification calls for. Because that would be the crucial issue of that they behave in ways that's appropriate for a hub agency. And not be self-serving for themselves.
Will be this kind of model elsewhere in the nation, and how it is working?
Charlie, can you speak to that? If this model that you're proposing exists elsewhere in the nation, if you've seen a best practice or a further along advancement of this somewhere?
I think I heard the question correctly, and Jason, thank you for repeating it. This is one of the most aggressive approaches with regard to thinking about, one, a CCBHC program, so a Certified Behavioral Health Clinic program, really becoming a community model. And in our work, as well as in my professional work with the CCBHC structure for the last 8 years, since it started 8 years ago, they have been really uniquely defined as a model within a particular mental health agency. And in this case, in Winnebago County, that's Rosecrans. This model actually extends that CCBHC model to really create a community of care that wraps around that model, but recognizes the individuality of each of the spokes, recognizes the role and function that many of you are talking about, that does not have to be employed by or a member of Rosecrans as the CCBHC, but really extends that model so that people all have a role. They feel as though there's a larger network that they can easily connect to, and there's always individual choice that is elevated throughout this model. So I think back to the question is this being done elsewhere? I do know that Missouri, I do know that colleagues of mine in Washington, which is, I'm actually in Washington today, are beginning to look at this very thing as creating community infrastructure to support and wrap around services within around the CCBHC. Are there any leading candidates who are actually doing this and actually have metrics and showcasing this? Not specifically, not at least around the CCBHC, but we do know in communities like Walla Walla, Washington, that have actually built their community prevention programs for mental health and substance use around the ACEs study, so Adverse Childhood Experiences study, have found that community collaboration, community coordination to really be significantly powerful in making sure that the community recognizes there's equitable access points, they can get into the system. The CCBHC, different than that, actually has a funding and data requirements as well as platforms to encourage partnership, which is what we're proposing in this report for you. But I appreciate all of the comments and the cogitation that you're going through, which is wonderful to hear, and you're bringing up all the right points. And I think that it also showcases how important you as a board are for the community to ensure the successfulness of this system of care and potentially this model that we are proposing for you.
Jamin, would you like to speak to the next steps in terms of giving the board members the opportunity to provide direct feedback on the report, the draft report?
Yeah, Jason, our understanding is that and we're happy to coordinate the delivery of the report to the committee members for review and feedback. That can happen as soon as I think we are given the green light to do that. If that's easier for someone within the board to share with the entire group, we're also happy to coordinate. Jason, if that's through you or Dan or other entities, happy to do that as needed, and we'll take our lead from there. But I think at this point we're ready to go ahead and share whenever we get the green light. Charlie, any concerns with that approach?
Not one bit, and we welcome if you do have time and would like to kind of give us some feedback on the report, we'd be happy to take that. We're looking to have any comments I think received by the end of this week, so that way we'll have everything finalized and to all of you by Monday.
And Charlie, sorry if I can chime in. Yes, you will be seeing an email from me shortly after this call with an attached PDF of the entire report. And you can provide any feedback directly by responding to that email by the end of this week.
Thanks, Kiara.
Crystal clear. So it is that when this meeting is over, you'll get the email directly from Guidehouse with the report, and you can respond back directly to them with any questions, comments.
Final report. 100 and
It's long. Doing it from, I mean, as you would expect, there's, I would call it executive summary up front, and then a deeper dive into the summary and the recommendations, and then there's a significant amount of appendix related information that provides support back to the conclusions that are mentioned in the report.
Well, the devil in this one is in the details. How this is implemented, the coordination, Rosecrance's role. That's where it all falls down to. That's where the details are at, which we have to see and review and talk about.
Yeah. Yeah.
Well, and really, we also have to see how the spokes are gonna coordinate with each other, because that's a big part of this whole execution. Yeah, Tim?
So one of the things I'm concerned with is, also with Rosecrans being the hub. And in general, like in a lot of areas of the community, Rosecrans leaves a bad taste in the community. And I know Rosecrans acquired Janet Waddles, and just as a hub, would they be willing to just reintroduce the Janet Waddles brand as the hub instead of just saying Rosecrans, just for appearances?
Jason, I don't know the step friends. That is something that we talked about as a committee as well, with Rosecrans involved. I mean, I think that a lot of the topics that were brought up here were the very same things that the committee considered, which is, while we say Rosecrans, we're talking about CCBHC as the hub. And so we talked about the fact that there may need to be some rebranding, so to speak, of this CCBHC in terms of the messaging that it sends to the community.
Rosecrans aware, heavily involved in your decisions or your recommendation?
But we've been involved since day one. So we intentionally didn't ask partners and members of the committee to come so that you were able to focus your time on Guidehouse. But yeah, Rosecrans has played, as have really all of the partners and key roles since the beginning. And it'll be in the report, you'll be able to see that there's it's about 25 partners that were involved in April 1.
All right, thank you, Guidehouse, for attending and presenting today, and please let me know if you have any issues getting the report out to the board members, so we can have information on them.
Well, thank you very much, and we've really enjoyed the time, and this has been an exciting project to join you with, and we look forward to hearing if you have any comments but most importantly, sharing with you the overall report and recommendations. Thank you all very much.
Thank you all very much.
Okay, Jason, we're going to sign off unless you guys would like us to stick around.
Okay, moving on. The rest of the agenda, the monthly activity report to July.
Sure, I'll just give a couple of highlights, one of which was coordinating with the advisory committee and the consultants to give this presentation today and to finalize the draft of the report for final review. And then I will highlight also, we have our summer interns who are wrapping up their summer internships. That's become a great opportunity for local talent to plug into public sector and get that experience, but also we find they bring a lot of innovation and new ideas to the work. And some of our summer crew this summer helped us with updating the data dashboard, which we will present to you at the next board meeting, and find that it is going to be a little more easy to understand and accessible, so that there's some, well, I won't tease too much, but we'll show you in September. That's my teaser.
All right, moving into our action items, so we need a motion for the July 2025 meeting minutes. Second. Thank you very much. Any addition, corrections? Hearing none. All those in approval, please say aye.
Aye.
Opposed, same sign. Moving into our next resolution to be presented. It's 2025X, and it's a resolution authorizing funded program budgets update for programs year 4 to 6. And this would include the City of Rockford Inclusive Wellness Programming at the Family Peace Center. Jason, do you want to just kind of?
Sure, there's some information in your packet. I'll give a brief update, and then we do have a representative from Family Peace Center here to answer questions if you have them. But essentially, this was to allow for the contracting of telehealth services for those that are not able to, for whatever reason, transportation or other issues, not able to be on site at the Family Peace Center for counseling services. So it's just to supplement the kind of array of services that are being provided there.
So I will need a motion for the board to approve the following, including the consultant decrease by 25,000, and then the contracted professionals increase by 25,000. Okay. Okay, very good. This one, I think, will. Andrea Bradshaw. Yes. Dr. Copeland. Dr. Giardini.
Yes.
Dr. Gorski.
Yes.
Dick Cooner.
Yes.
Tim Neighbors.
Yes.
Jeff Nielsen.
Yes.
Dr. Penny.
Yes.
Mohammed Yunus. Mariana Bada, yes. Okay, in the second resolution, 2025XX, authorizing audit waiver for program year 4.
Sure. So we've done a couple of these already. It was my hope we could do them all together, but I don't think maybe everyone understood what we were asking the first time we asked. So it's okay. Everyone is required to do an audit per contract. Some of the organization's operational budget is of a size that they are not required by the state to do that, and it is sufficiently costly to do that. So they have requested to do a professional financial review in lieu of a full audit. We have already granted this to 2 other organizations who are of similar size. I should say the board has authorized that. And so there are 2 additional organizations now with operational budgets under the state threshold requesting to do a professional financial review in lieu of the full.
I just have one question, Jason. So I was reading this resolution and it says the state of Illinois, blah, 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 and in excess of 300, but no more than 500. So theoretically, under 300, they don't have to supply any.
Per state requirements, they would not have to, but per the mental health code requirements, they would still need to.
Yes.
Got it. One. That's what we should.
How much does it cost for the financial audit?
I was hearing figures over $10,000 from nonprofits recently. I believe that was actually part of NICME, Northern Illinois Center for Nonprofit Excellence, when they had surveyed nonprofits, that was one of their questions, and they were seeing significant increases in that professional service. So they were one of the first that brought it to our attention to say, hey, these costs are going up significantly, and they're not actually required by state. And some of the things a professional financial review would do would really meet the intent, whereas the audit is kind of designed for larger organizations.
$10,000 is not that much to pay the amount of grant that $500,000, $10,000 is not that much to make sure that property.
But it's not required.
Even if it's not required, it's safe in the responsibility. You have to be interested to make sure that the bills are respected properly. Just don't. So 10,000 is not much. That is $500,000.
So just for example, in the one piece of evidence that's supplied in the board packet, the Tommy Corral Memorial Foundation, which is one of the organizations requesting, their annual operating budget is $80,000, and their grant from
Maybe in that case is not.
so that would be a significant portion.
That is the $500,000.
Well, that would, what you're bringing up is a discussion we have to have another time. I mean, right now, the requirements are in the way of this audit requirement for other agencies. So we have to change our.
Okay.
And then our practice.
If you think, you know, not to belabor the point, but I'm noticing Danielle Angelary's letter, which does talk about a thorough and independent evaluation of financial health. So defining what financial review is, maybe that's a bit of Mohammed's discomfort is, you know, having gone through audits where I used to work on very elaborate things, external. So is the definition of a financial review, does it imply some independence? And I don't know that.
The practice has been independent financial review by those that have requested
Absolutely.
it. Okay. So we can.
Seems important.
So it's the third part.
Yeah.
Yeah.
I mean, it doesn't say that. I mean, someone could apply or independent or internally financial review.
Right. That's.
Okay.
Yeah, so we could definitely look at defining that now that we've crossed this threshold, defining that for future grant contracts, so it's more detailed. But as it's been approved and as we enforced it with the agencies, it has been independent third-party financial reviews done by accounting firms or something, but it's been at a slightly lower cost than what the full audit entails.
Absolutely.
So at this point, yes.
These agencies are not able to hire professionals to maintain their grants. So that could be a lot of loopholes that they are not sure is right or wrong. There's some kind of audit that can guide them that is the right way to do things. It's not just negative, it's positive concern too. But, because generally, I mean, they are not competent people. That is not their priority to have a good fiscal system, to take control system. But we, public interest has to monitor, it's our responsibility to make sure that money is spent properly.
No, well, we can get as specific as we want with the independent financial review requirement, so. But at this juncture, I need a motion to approve what, this amendment, yes. Andres?
Second.
And Bill, you second it, okay. The roll call for this is Andrell Bradshaw.
Yes.
Dr. Copeland, Dr. Jardine,
Yes.
Dr. Gorski. Dick Kunert.
Yes.
Tim Neighbors.
Yes.
Jeff Nielsen.
Yes.
Dr. Penny.
Yes.
Mohammed Yunus.
Yes.
Mary Ann Abadi, yes. And finally, under action items, is the grassroots funding notice, funding opportunity. So Jason, do you want to just,
I feel that we've discussed it pretty thoroughly over the past, 4, 5, 6 months. I've tried to bring as much information to you in advance of us even developing this funding opportunity. Everything you're being presented today is basically a second iteration of something you've already seen and had the opportunity to provide feedback on. We did get feedback from some board members and incorporated that, and we've also had legal review and incorporated all of legal's feedback exactly as it was given to us. And so this is now the notice with the timeline, and if approved, this will be going live this week.
any discussion?
Couple of questions. Maybe anyway, how long, if you don't have a candidate, if they're not part of that system, how long does that take to get it? You know?
Alex, do you know?
They keep a running list of all registered nonprofits, so
If a nonprofit has not applied for that, how long does that take, you know?
I'm unsure of that, and definitely get you an answer though.
I'm just curious, we've got a pretty tight timeline. If they don't have it, is that timeline gonna keep them out of the process? That's where I'm going.
I think that we have it's not a fast process if you look at all the layers of it, because for the full application, it's first going through the letter of interest phase. So I think if that becomes a barrier for a particular organization, we could draw that to the board's attention, that they're in process of getting that. You know, being this is our first time going through it, we'll have a little bit of a learning curve on that, but we're talking from August to March for final decisions to be made. So at least by that point at the decision-making process, there should have been sufficient time to get the team. Appreciate the thoughtfulness of that, and definitely will keep an eye on that and see what we learn from organizations in terms of that process.
One more on timeline. 30 days on the yellow lights, correct?
Yes.
If an organization is not familiar with this process, they're small, they haven't done it, does that give them enough time to put their letter together? I realize the question is late in the process. Reading all this stuff, well, that's required. For a small organization, look at this and goes, oh, I'd like to do this, but I have to do this. Have we given them enough time?
The letter of interest, I think, from my perspective, yes, from having gone through other funding opportunities, because we didn't rush this and we've been actually talking about it as a board for about 6 months, a lot of people already have awareness of it. I have a few presentations scheduled over the next 2 weeks as well with partner networks that will get the information out. We're distributing everything through social media. We have a press release ready to go. We have partner organizations that are ready to put that information out in their networks. So I think the saturation of information will be there. The letter of interest process is pretty simple. It shouldn't take an organization, other than knowing what they want to do, more than an hour to actually put the information in. And that's feedback that we had from earlier funding opportunities where we were going straight to full application. People were investing 20, 30 hours of their time into something that was maybe completely out of alignment with what the board was looking to fund, and they felt that they had wasted a lot of their time. So the letter of interest has been kind of, say, best practice that we've implemented from that feedback to make it not heavy time investment up front until the idea is vetted and say, okay, yes, now put the time in to give us the full pitch.
Okay, thank you.
In the September 15th, October 10th board evaluations, do you would like all board members to review the LOIs? If not, will just be.
What we've done in the past and per policy, it's not dictated a specific number of board members. So I think it's going to be a function of how many we actually get. If there's 100 of them and there's 10 board members available to review, we may do 2 board members each review 20 or something. We'll have to do the math on that. So especially when we've done new funding opportunities, and it's hard to predict what the response will be. We've kind of tried to match the availability to the demand rather than specifying a restricted process up front.
And from us, is that just a yay or nay to proceed further, or a yay or nay with feedback?
Yeah, so 3 options, and there's some commentary, and then the 3 options would be not to accept an application, to accept a full application as the idea is presented, or to accept a full application with some type of modification or direct feedback to the organization to make an adjustment.
And the LOIs would be unfounded?
Yes. We will make sure that moving forward, everything is unfounded. It's the best way to do it. One system for all information.
Yes.
Terrific. Great question.
Okay, there's going to be a motion.
So moved.
Second, what do you need?
I'm moving.
The grass. Okay. All right, the grassroots funding, actual notice of funding opportunity. All right. I need a second. Oh, we're not sure. Okay. But this is just can do.
Yeah, you don't have.
Right, okay. Any further discussion or questions? Hearing none, all those in favor, please say aye. Aye. Thank you. All right. To my knowledge, there's no discussion items or other matters on the report. Pardon me, Tim?
I just wanted to go back to the Guy House presentation. This is just a question for Jason. How would this affect our, I guess, just the addition that we want to try to add with the children's care center that we want to, the model that we got from St. Louis and Miami?
Oh, sure.
How
Yeah.
would that affect that?
Oh, the grassroots funding? Yeah. So the grassroots funding was what was modeled after the Children's Service Fund in St. Louis. So I think that the service types that are included in the grassroots funding are client identification outreach, mental health services that could be contracted through a mental health service provider, peer support, or community education and outreach. I don't know at today that we're ready to dictate some type of, encouraged or forced partnership to a CCBHC model from grassroots funding, but in a future iteration, I don't think anybody that I've spoken to about this model doesn't see the need for there still to be small community-based organizations that are participating in the community system, care system. But it's how when the higher levels of care are needed, such as residential inpatient treatment or things that are outside of the scope of a small community-based organization, are those referral lines built? And I think that's the work that we may have to look at with this, but I don't know that, because the timing of it is such that we're launching this today as we're just getting this model envisioned. I don't think we're there yet to know specifically how that's going to work, from my perspective. We don't have the contracts completely finalized. They're drafted and they're under legal review, so by the time we get into contracting in March or April of next year, if we see a more specific referral line that needs to be there, we could dictate that by contract.
What that cost us? Do we have an idea about? With Rosecrest being the center of, I know they're gonna request more funding.
Well, I don't know, because actually the challenge might be the opposite thing, which is that they're gonna be reimbursed at a higher rate for their services. And those that contract and partner with them in the CCHB model will also be reimbursed at cost for their services. So the challenge might be the opposite challenge, which is how will the funding be used to support the broader framework when a lot of those direct services are being reimbursed at cost.
Could we put that on the agenda for next month? That we ask you to first down the consultant's report, look at it from the standpoint of like, where does it take us from where we are now to like what it is that we might be doing?
Absolutely, yes.
Okay.
We'll do that.
And one comment, since we're back on the guidance report, I really was encouraged to see there is really strong alignment with our strategic plan and our goals as been comparing to theirs. And I think a lot of the work that we've been doing aligns very well. It's not coordinated to the extent that we want it to be, but nevertheless, I think we've invested our dollars wisely in the programming that is necessary for it.
Yeah, and I think, you know, our issue in the community has been so centered around access and payment.
That's the whole
The
thing.
CCDHC thing is kind of a game changer. It's a game changer.
Just get the feedback that people see that. What is the program?
I'm sorry.
His concern about the Spokane.
I agree.
And how do they feel about the program? I move for adjournment.
I have a quick question, I'm sorry. Oh, do you have any updates on the addition of a new board member?
Generally speaking, it takes a very long time.
I don't know. It's a lot of discussion. That I'm not privy to, but given anything.
We've had a lot of work, so.
Yeah. 10 applications right away.
We did submit a name, so.
Oh, yeah.
It's been quite a while.
Two names.
Yeah, it's been a few months.
Yeah.
Still.
Okay, so.
Hang in there with the 10.
No.
Not yet. I did. We have a second, so.
All those in favor of adjournment?
You got a second?
I do.
A second.
Oh,
Yeah.
I missed that.
All those in favor?
Aye.
Aye. Opposed?
All right, I guess not referencing any usage, but see you in September.
Yeah.
You gotta go back to that.